Hey everyone, and welcome back for another deep dive with us. So today, we're going to be tackling a topic that is absolutely essential for any nursing student out there.
Yeah,
Um, and that's the ethical and legal side of mental health care.
that's a big one.
It is a big one.
Yeah.
And you know what? We're going to customize this deep dive just for you guys as a study guide for your upcoming exam.
Ooh.
So we've got excerpts from your textbook chapter. We've got that mental health nursing test bank that I know you guys have been sweating over.
Been there.
And even some highlights from your recent lecture.
Nice.
Yeah, so we're going to make sure you're not just memorizing facts, but really understanding how these concepts actually come into play on the floor,
Yes.
no matter where you end up working.
That's a critical point because these aren't just issues for psych nurses
Right.
tucked away on a dedicated unit.
Yeah.
Every nurse you know, whether you're in the ER or pediatrics or even a cardiology clinic,
Oh, yeah.
you're going to face situations where a patient's mental health intersects with ethical and legal considerations.
Absolutely. 100%.
Yeah.
So let's unpack this, starting with the basics.
Okay.
Why should nurses be so well versed in the law when it comes to mental health? What do you think?
Well, the law, it provides a framework for safe and accountable care.
Mm-hmm.
It's about protecting you and your patients.
Yeah.
So imagine the scenario. You have a patient who's refusing a life-saving medication.
Okay.
Do you know the legal grounds for intervening in that situation?
That's a good question.
Yeah, and understanding those boundaries
Yeah.
is crucial for making sound decisions
Right.
in those really high-stakes moments.
Absolutely.
Yeah,
It's not just about knowing the rules, it's about
Right.
knowing when and how to apply them.
exactly.
Yeah. Okay, so now let's talk about all those terms that get thrown around all the time.
Oh, yeah.
Ethics, bioethics, morals, values.
It's a lot.
They all seem so similar.
They do, but those subtle differences are really important.
Okay,
So ethics is like the big umbrella term. It's the study of right and wrong.
got it.
Bioethics narrows that focus down to ethical issues, specifically in healthcare.
Cool.
So think about end-of-life decisions
Mm-hmm.
or genetic testing,
Yeah,
heavy stuff.
Yeah. for sure.
So then morals are more personal,
Okay,
like your own beliefs about what's right and wrong.
got it.
Values are what you prioritize in life,
Mhm.
things like honesty or compassion.
Okay, yeah, that makes sense.
Yeah.
So how do those personal values then come into play when you're dealing with patients who have mental health challenges?
That is where values clarification becomes so crucial.
Okay.
It's like taking inventory of your own beliefs
Hmm.
and understanding how they might influence your actions.
Right.
For example, let's say you have a really strong personal belief in individual freedom.
Okay.
How would that then influence your approach to caring for a patient who's involuntarily committed?
Wow. Yeah, that would definitely create some internal conflict.
Right.
Like, you believe in freedom, but also have to ensure the patient's safety and follow the law.
You got it.
Yeah.
Mental health nursing is full of these gray areas where your own personal values might be tested,
Right?
and there's rarely a clear-cut right answer.
For sure. Okay, so speaking of tricky situations, let's move on to those ethical frameworks.
Okay.
It's like having different lenses to view a problem through.
Right. That's a good way to put it.
We learned about utilitarianism, doing the most good for the most people.
Mm-hmm.
Then there's Kantianism, which focuses on the act itself, like that question in our textbook,
Yes.
about the nurse, who felt that it was their duty to care for the patient regardless of the outcome.
Exactly. And remember, these are just frameworks,
Okay?
not rigid rules.
Okay.
You might find yourself drawing on different perspectives.
Yeah.
Depending on the specific ethical dilemma that you're facing.
That makes sense.
Take that utilitarianism example.
Okay.
What happens when resources are scarce?
Oh, right.
Who gets the priority?
Yeah,
These aren't easy decisions.
absolutely not.
Okay.
So ethical dilemmas are a given,
Mm-hmm.
and we have these different frameworks to kind of help us make sense of them.
Yeah.
But what about those big ethical principles? Autonomy, beneficence, non-maleficence, justice.
I know, right?
Is a mouthful.
It feels like a lot.
Yeah.
But those principles, they act as a common language
Okay.
for ethical decision-making in healthcare.
Got it.
So let's break it down.
Okay.
Autonomy is all about respecting the patient's right to make their own choices,
Mm-hmm.
even if we disagree with them.
Okay.
Beneficence means acting in their best interest, advocating for their well-being.
Got it.
Non-maleficence, do no harm.
Right.
Seems straightforward.
Yeah.
But it gets tricky when you consider the potential side effects of medications
Oh, yeah.
or the use of restraints.
For sure.
And then there's justice, ensuring fair and equitable treatment for all.
Right. So let's say you have a patient who is refusing a medication that could really help them.
Okay.
How do you navigate that when their autonomy clashes with your desire to act beneficently?
That's the crux of it. It's not about imposing your will or dismissing their concerns. It's
Yeah.
about open communication education
Mm.
and finding a balance that respects their autonomy while also advocating for what's best for them.
Okay. Yeah, that makes a lot of sense.
Yeah.
So let's get into some situations that are specific to mental health nursing.
Okay.
Are there any particular patient rights that we need to be extra aware of in this field?
Absolutely. You'll dive deeper into this in your legal studies. But the big ones are the right to treatment, the right to refuse treatment, and the right to the least restrictive environment.
Hold on, break that down for me. What does least restrictive environment actually mean in practice?
So think about it this way. If a patient can be safely and effectively treated in an outpatient setting, they shouldn't be hospitalized against their will.
Okay.
Or if a patient can be managed on a less secure unit within the hospital,
Right.
they shouldn't be placed in seclusion or restraints unnecessarily.
Got it.
Yeah.
So it's about finding that sweet spot
Yes.
where the patient gets the care they need while still maintaining as much freedom and dignity as possible.
Exactly. But finding that sweet spot
Yeah.
often involves tough calls.
Right.
Imagine you're caring for a patient who's becoming increasingly agitated.
Okay.
How do you determine when their behavior crosses the line from being simply disruptive
Right.
to a safety risk that actually requires intervention?
That's a tough one.
Yeah.
I can see how those judgment calls would require a deep understanding of both the clinical picture
Yeah.
and the legal and ethical considerations at play.
And that's why it's so important to go beyond just memorizing definitions. You need to start thinking critically, imagining yourself in these scenarios,
Yeah.
and wrestling with those tough decisions.
Yeah. I'm starting to feel the weight of all of this, but I also feel more prepared to tackle these challenges.
That's the goal.
Yeah.
We're not just trying to load you up with facts. We're trying to help you develop that ethical compass that'll guide you throughout your entire nursing career.
Awesome. So are we ready to dive into the actual legal landscape now?
Let's do it.
All right, let's do it. All right, buckle up, everybody, because we are about to navigate the legal side of mental health care.
Ooh, yeah.
We're talking laws, policies, and real-world consequences here.
I know it can feel kind of overwhelming,
Yeah.
but it's really all about building that solid foundation.
Right.
Think of it as adding more tools to your nursing toolkit.
Yep.
The more you know, the better equipped you'll be to advocate for your patients and to practice safely.
I like it. Okay, so let's start with the big picture.
Okay.
What are some of the key laws that govern mental health care?
Well, you've got federal laws like high pay.
Right.
That's the one that protects patient privacy and confidentiality.
Right.
And remember, it's not just about gossiping in the break room.
Yeah.
It's about being mindful of how you discuss patient information, even with colleagues.
Yeah.
Then you have state laws like the Nurse Practice Act, which outlines what nurses can and cannot do,
Right.
your scope of practice. And then there are laws specific to mental health,
Okay.
like those governing involuntary commitment, which we'll unpack in a bit.
Okay, wait, before we get to involuntary commitment,
Okay.
what about that Patient Self-Determination Act?
Ah, yes.
I remember that from the lecture,
Yeah.
but I'm still a little fuzzy on it.
The Patient Self-Determination Act is all about empowering patients
Okay.
to make decisions about their own care, including end-of-life choices.
Okay.
So think about living wills
Okay.
or advance directives.
Right.
Those are tools that allow patients to express their wishes,
Mm-hmm.
even if they're unable to communicate them later on.
So even in mental health, patients still get a say in their treatment. It's
Exactly.
not just the doctor calling all the shots.
Right. It's about shared decision-making,
Okay.
respecting the patient's autonomy whenever possible.
Right.
But as you can imagine, it can get kind of tricky
Yeah.
when a patient's mental state
Yeah.
might be impairing their judgment.
For sure.
That's where those legal and ethical gray areas come in.
Okay, now let's tackle involuntary commitment.
Okay.
It's a topic that always makes me think of those dramatic scenes in movies.
Uh-huh.
You know, someone being dragged away in a straitjacket.
Yeah. Hollywood loves to sensationalize it.
Right.
It's definitely not as dramatic as they portray it.
Okay.
Involuntary commitment is a serious legal process
Mm-hmm.
with very strict criteria.
Okay.
Remember those 3 key elements we discussed earlier?
Yeah.
Danger to self, danger to others, and grave disability.
Right. It's not just about someone being different
Exactly.
or difficult to deal with.
Right.
There has to be like a real and imminent risk of harm.
100%. So let's say you're working in the ER
Okay.
and a patient is brought in after expressing suicidal thoughts.
Okay.
That clearly falls under danger to self,
Yeah.
right?
I can see that. But what about those other criteria?
Okay.
What would danger to others look like in a real-world scenario?
So imagine a patient who's making credible threats
Okay.
to harm a specific person or group of people, or someone who's exhibiting aggressive behavior that could escalate into violence.
Right.
Those are situations where involuntary commitment
Yeah.
might be necessary to actually protect others.
Okay. That makes sense. And grave disability. That one's a bit harder for me to grasp.
Okay.
Can you give me an example of what that might look like?
So think about a patient who's so severely depressed or psychotic
Oh, okay.
that they're unable to meet their basic needs for survival.
Got it.
They might be neglecting their hygiene, refusing to eat or drink, or wandering aimlessly without proper clothing or shelter.
Wow.
Those are situations where their mental illness is actually preventing them from caring for themselves,
Yeah.
putting them at serious risk.
So involuntary commitment isn't just about preventing immediate harm.
Right.
It's also about protecting those who might be unable to protect themselves due to their mental state.
That's a great way to put it. It's all about balancing individual rights
Yeah.
with the need to ensure safety and well-being.
Mm-hmm.
But remember, involuntary commitment is a last resort.
Got it.
There are a lot of steps that have to be taken before it gets to that point.
Like what? Walk me through the process.
Okay, so it varies by state,
Okay.
but generally it starts with a professional evaluation.
Got it.
Often, two independent mental health professionals
Okay.
will assess the individual to determine if they meet the criteria for involuntary commitment.
So it's not just one person making that decision?
No, right? There are checks and balances to ensure it's not taken lightly.
Okay.
So if the evaluators agree that the criteria are met,
Mm-hmm.
then a petition for involuntary commitment
Okay.
is filed with the court.
Okay, so what happens next?
A formal hearing is scheduled
Okay.
where the individual has the right to legal representation.
Got it.
This is where things can get kind of complex.
Yeah.
Imagine you're caring for a patient who's going through this process. They
Right.
might be scared, confused, or even angry.
For sure.
It's your job to advocate for them,
Mhm.
to explain the process in a way they can understand, and to ensure their rights are being protected.
Wow, that's a lot of responsibility.
It is, but remember, you're not alone.
Right.
You'll have a team of professionals to support you.
Yeah.
Doctors, social workers, lawyers,
Right.
and you'll have access to policies and procedures
Okay.
to guide your actions.
I'm starting to see how all these pieces kind of fit together.
Yeah.
It's not just about memorizing facts. It's about understanding the process
Exactly.
and knowing where to turn for guidance.
Yeah, you got it. And don't forget about documentation
Oh, right. Documentation.
and mental health, especially when dealing with issues like involuntary commitment or the use of restraints.
Right.
Thorough and accurate documentation is absolutely crucial.
Okay, speaking of documentation, let's shift gears for a moment
Okay.
and talk about those scary legal terms
Yeah.
that every nursing student dreads.
I know, Ray.
Negligence and malpractice.
Those words can make anyone sweat a little,
Yeah.
but really they're not as intimidating as they sound. Once you break them down, negligence is basically failing to provide the level of care
Okay.
that a reasonable and prudent nurse would in a similar situation.
So it's like if you know you should be doing something,
Mm-hmm.
but you don't do it,
Right.
and then the patient is harmed because of your inaction.
Exactly. And malpractice is a specific type of negligence
Okay.
that occurs in a professional setting.
Right.
It involves a breach of the duty of care
Mm-hmm.
that a healthcare professional owes to their patient.
Okay, so give me a real-world example.
Okay.
How could a nurse be found negligent in a mental health setting?
Let's say you're caring for a patient who's expressed suicidal thoughts.
Okay,
You know, you need to implement suicide precautions,
right.
but you get distracted and forget to communicate those precautions to the rest of the team.
Mm-hmm.
Then during the next shift, change the patient attempts suicide.
Oh, wow. I see how that could be considered negligence.
Right.
The nurse knew what needed to be done but failed to act,
Yeah,
resulting in harm to the patient.
exactly.
Yeah.
Or consider a scenario where a nurse administers a medication without properly checking for allergies.
Right.
If the patient has a severe allergic reaction,
Yeah.
that could be considered malpractice.
Yikes. Those examples really hit home.
I know, right?
It makes me realize how every action we take as nurses
Yeah.
has the potential for really serious consequences.
That's why it's so crucial to be vigilant,
Right.
to double-check your work, and to never hesitate to ask for help or clarification if you're unsure about something.
Okay, let's circle back to documentation for a minute.
Okay.
Why is it so important in mental health care?
Documentation is your best defense in a potential legal case.
Okay.
Think of it as painting a picture of what happened, the decisions you made and why you made them.
Right.
It needs to be clear, concise, objective,
Right.
and stick to the facts.
So it's not just about like jotting down a few quick notes. We need to be detailed and specific.
Exactly. Instead of just writing, patient was agitated.
Yep.
Describe the specific behaviors that you observed.
Right.
Patient paced the hallway, clenched his fists, and spoke in a loud, demanding tone.
Wow.
Paint a picture with your words so that anyone reading your notes
Right.
can understand exactly what transpired.
Got it. And what about those 5 key elements of malpractice
Yes.
that Catalano outlines in the textbook, duty, breach, injury, causation? How do those come into play when we're documenting?
So those elements are the foundation of any malpractice claim.
Okay.
Duty means that you had a professional obligation to the patient.
Okay.
Breach means that you've violated that duty in some way.
Right.
Injury means the patient suffered harm as a result of your actions or inaction.
Got it.
Causation means there's a direct link between your breach of duty and the patient's injury.
Okay.
And damages are the actual losses that the patient incurred,
Right.
like medical expenses or lost wages.
Okay. So when we're documenting, we need to keep those 5 elements in mind.
Yes.
And make sure we're providing enough detail
Exactly.
to demonstrate that we fulfilled our duty of care.
Precisely, your documentation can be your best advocate
Right.
in a really sticky situation.
This is all a lot to take in,
I know.
but I feel like I'm starting to connect the dots between the ethical principles,
Yeah.
the legal frameworks,
Mm-hmm.
and like the practical realities of nursing.
That's great to hear. And remember, it's a journey.
Yeah.
You don't have to master everything overnight.
Right.
The key is to be curious, to ask questions, and to keep learning.
So where do we go from here?
Okay.
We've covered a lot of ground,
We have.
but I'm sure there's still more to explore.
Absolutely. We've laid a strong foundation.
Yeah.
But there's always more to learn about the nuances of ethical and legal decision-making
Right.
in mental health care.
Like what? Give me a sneak peek of what's coming next.
Okay, so we've talked about the rights of patients.
Right.
But what about the rights of nurses?
Oh, interesting.
What happens when your ethical obligations
Yeah.
conflict with a physician's orders? And how do you navigate the complex world of informed consent
Right.
when you're dealing with patients who might have impaired decision-making capacity?
That's a good one.
Those are just a few of the topics we'll be diving into in our next deep dive.
Okay. I'm officially hooked. Bring on the next round of ethical and legal challenges.
All right, I'm ready when you are.
All right, so let's wrap up this deep dive with some scenarios to really test your knowledge.
Okay.
Remember, this is all about preparing you for those tough calls you'll face as a nurse out there,
Exactly.
not just acing that exam.
Right.
So let's go back to patient rights for a second.
Okay.
What stood out to you about how those rights play out, even when someone is involuntarily committed?
It's like we're saying, yes, your mental state might require us to intervene, but you're still a person with rights and dignity.
Right.
It's a really delicate balance.
It is. Think about the right to refuse treatment.
Yeah.
Just because a patient is hospitalized involuntarily doesn't mean they automatically lose their right to say no to medications or therapies. There are legal procedures in place to ensure those decisions are made carefully and ethically.
Right.
Okay, I'm starting to get it. So as a nurse, I need to be aware of those procedures and advocate for my patient's voice, even when they're in a really vulnerable position.
Precisely. And that advocacy
Yeah.
might involve educating the patient about their options,
Okay.
helping them communicate their wishes to the treatment team,
Mm-hmm.
or even challenging a doctor's orders
Wow.
if you believe they're not in the patient's best interest.
Wow, that's a lot of responsibility.
It is.
But also incredibly empowering. It makes me feel like I can really make a difference in my patients' lives.
You absolutely can.
Yeah.
Now let's tackle another tough topic.
Okay.
Restraints.
Ooh, yeah.
It's something that makes a lot of nurses uneasy,
Yeah.
and rightfully so.
Yeah.
It's such a powerful intervention, you know, taking away someone's freedom of movement.
Restraints always feel like a last resort. something we only use in really extreme situations. But what really stuck with me is the idea that even when restraints are necessary, we can't treat the patient like they're no longer a person.
That's such an important point. Restraints should never be used as a punishment.
Right.
Or a way to control a patient.
Right.
They're a safety intervention. And even then, they need to be used with the utmost care and respect for the individual's dignity.
So even if a patient is kicking and screaming, we still need to communicate with them clearly.
Yes.
Explain why the restraints are being used and reassure them that we're there to help.
Exactly. And remember all those safeguards that we discussed.
Right.
Monitoring the patient's physical and emotional well-being, ensuring the restraints are applied correctly.
Yeah.
Removing them as soon as it's safe to do so.
Okay, last scenario for our mental health deep dive.
Okay, hit me.
Imagine you're caring for a patient who was voluntarily admitted.
Okay.
But they suddenly start expressing suicidal thoughts.
Ooh, okay.
Does their legal status change? And what are my responsibilities as a nurse?
This is a classic example of how a patient's mental state and legal status can shift so quickly. Even though they initially agreed to hospitalization, those suicidal thoughts now meet the criteria for involuntary commitment.
So I can't just ignore it or hope they'll feel better in the morning?
No.
You need to act immediately.
Absolutely. You have a duty to protect your patient from harm.
Right.
And that means notifying the treatment team, initiating the necessary legal procedures, and ensuring the patient is closely monitored.
Okay, I'm starting to feel the weight of all this responsibility.
I know, it's a lot.
But I also feel much more prepared to handle these situations now.
That's the whole point of this deep dive.
Yeah.
We've covered a lot of ground.
We have.
From ethical theories to legal cases to real-world scenarios.
Yes.
You're now armed with the knowledge to not only rock that exam, but more importantly, to provide safe, ethical, and compassionate care to your mental health patients.
It's more than just memorizing facts. It's about developing that critical thinking mindset.
Yes.
That ethical compass that will guide you throughout your entire nursing career.
Exactly. Remember, every patient encounter, every decision you make has ethical implications.
Right.
Keep those principles of autonomy, beneficence, non-maleficence, justice, and veracity at the forefront of your mind.
And when those inevitable gray areas pop up,
oh yeah, they will.
Don't hesitate to reach out for help. Consult with your experienced colleagues, review policies and procedures, or seek guidance from your ethical resources.
You're entering a complex and challenging field.
Yeah.
But also one that's incredibly rewarding.
Yeah.
By embracing that complexity and always striving to do what's right for your patients, you'll make a real difference in their lives.
Well, thank you so much for all of this amazing insight. I feel like I learned a lot today, and I know our listeners did too.
It was my pleasure.
Thanks for joining us on this mental health deep dive. Remember, keep learning, stay curious, and never stop advocating for your patients. We'll see you next time.